this 2-week extension of masking on public transportation. Can you help us understand some of the science behind this? Why 2 weeks?
What they're looking at is that since early April, there's been an increases in the 7-day moving average of the cases in the United States. So what they're trying to do is give a little bit more time to assess its potential impact, the rise of the cases have on severe disease, including hospitalizations and deaths, and the healthcare system capacity.
White House Press Secretary Jen Psaki explaining why the CDC extended the travel mask mandate. We're joined now by the White House COVID coordinator, Dr. Ashish Jha. Dr. Jha, thanks for joining us again this morning. You know, as we headed into this holiday weekend, cases were up in 31 states, hospitalizations up in 14 states. Are you worried about another surge coming out of this holiday?
Good morning, George. Thanks for having me here. You know, the good news is that infection numbers are still low, and obviously hospitalizations right now are the lowest level of the pandemic. But as you said, BA2 is causing an increase in cases in many parts of the country. And I think what we need to be doing right now is monitoring this very carefully. I don't expect a surge at all like what we saw in January. I think that is extremely unlikely. But we've got to take these things seriously, monitor it closely, and see where it goes.
What do we know about BA2? Is the variant simply more transmissible, or is it better at evading our immune defenses?
Yeah, the good news on this, on BA2, is that our vaccines are holding up just fine. Especially if you're boosted, you're going to do fine. But the bottom line is that it is more transmissible, does not cause more severe disease, and the vaccines are holding up. So it's that transmissibility that's really causing it to increase in terms of infections across the country.
And that's why we're seeing this increase in cases. At least we've seen cities like Philadelphia reimpose their mask mandate. As we just saw, the travel mask mandate was extended as well. But what are the right criteria for reimposing mandates? Some experts, like Dr. Leanna Wen, say rising cases actually shouldn't be the trigger. We should focus on hospital capacity and whether vaccines are still working. Does that make sense?
Yeah, the CDC has laid out a framework on this that I think is quite good, and something I've been very supportive of actually for a while. And the CDC says we should look at a variety of things. We should look at cases. It should be one of the factors. But we should also be looking at hospitalizations, obviously, because that matters more. And then we should be looking at hospital capacity. And we should be making decisions based on all of those factors. And I think those all are important. And that's what the CDC guidance recommends. And I certainly agree that that's what we should be using.
Do you expect the travel mask mandate to be extended again?
You know, this is a CDC call decision by the CDC scientists. They made it very clear that they needed 15 days to assess the impact of BA2 on hospitalizations, deaths, to see if there's a substantial increase in severe disease. My expectation is that we're going to gather that data, and within a couple of weeks, we're going to make a more durable decision.
And what's your latest thinking on when or whether people should get an extra booster shot, a fourth shot?
Yeah, it's a very good question. You know, the data out of Israel is pretty compelling, and that's what really, I think, drove both the FDA and CDC to make the decisions it did. The data from Israel shows that people over 60, when they got that second booster 4 months after their first, not only do they have fewer infections, actually reduce mortality by a pretty substantial amount. So my recommendation right now, following the CDC and FDA guidance on this, is if you're over 60, you should be out there and you should be getting that second booster. 50 to 59, you're eligible. Depends on your risk profile. Worth having a conversation with your physician. There is a much closer call, but for me, based on the data, 60 and above, I think it's very reasonable. And this is what I've recommended to my elderly parents, and that's what I think people should do.
Is COVID still a crisis?
It is still a real challenge for our country, right? I mean, if you look at this, we still have lots of people getting infected. 400 Americans are still, 400 or 500 Americans are still dying every day of this virus. And we have seen pretty substantial evolution of this virus over time. So the pandemic is not over, as much as we all wish it were. We're in much, much better shape than we were, but we've got to keep plugging away at managing this virus and getting it under better control so we can get back to our lives.
You're about 2 weeks into the job at the White House. What have you learned about government work, and what's your biggest challenge going forward?
Yeah, what I've learned about government work is how enormously important it is to do what's the right thing for the American people. There are lots of people who have views, but for me and the advice I have gotten from my colleagues, and both in the White House and people, there is focus consistently and every day on what's good for the American people. Drown out the noise. If you do that, if you keep that as your North Star, it makes decision-making a lot easier, a lot more impactful. But obviously, that is what we are all there for, and that's what we should be doing.
Dr. Ashish Jha, thanks as always for your time and your information.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.